Okay, back to toxicology. Now we're looking at some other drugs that we might commonly see in the pre-hospital setting, and overall any setting. So we look at amphetamines, and Ritalin is something that's prescribed for ADHD and ADD. Now there are other um, um, amphetamines that are out there, and they'll mimic the same category. So just understand. So methamphetamine, speed, crank, ice, and crystal. These kind of all kind of work in that area, but to a lesser degree. To a lesser degree. So first, amphetamines. This will go back to the ADHD meds. These kind of cause hyperactivity, dilated pupils. As remember, they're kind of the sympathetic nervous system kicking in. So hypertension, maybe a tremor, seizure, because it just causes this kind of muscle fasciculation where they're just kind of very jittery. Unless there's some cardiac arrhythmias, then we'd kind of look at maintaining them or maintaining the management of these patients. And unless there's some type of seizure activity. Think about polysubstance. So if they were taking this, make sure they weren't taking something else to slow anything down, beta blockers, or to curb it, maybe a narcotic or barbiturate or a benzo. We don't want to negate the benzos. We don't by using romazicon or flumazenil. We don't want to eradicate the narcotics by giving them naloxone or Narcan, and we just get uncontrolled these kind of alpha and sympathetic tone effects. That goes back to methamphetamine. Causes this euphoria, their peak levels in their heart rate, hypertension, and men having chest pain, psychosis, anorexia, hallucinations. This can lead again to cardiac arrhythmias, MIs, and stroke. If there are cardiac arrhythmias, then kind of consider what we would give for cardiac arrhythmias. The tachycardia is something that we're going to see. Your adenosine might not touch this, as it's not something that is apparently being conducted. This is something, a toxin that they introduce into the bloodstream is going to irritate and cause increased automaticity of the myocardium and electrical conduction system. And with such, we're going to have an increased cardiac output, vasoconstriction, as it's a sympathetic type of, similar to sympathetic effects, and we're going to have hypertension. This may lead to fluid overload, or not necessarily fluid overload, but fluid then backing up into the pulmonary circuit, and they may end up having some kind of issues. Now, usually you don't have fluid building up in the pulmonary circuit unless there's a myocardial insult or event where the valve is injured. We go into other things like marijuana. Now, marijuana just causes some euphoria, and sometimes it just depends on the THC versus the CBD content. These guys are rarely overdose on this stuff, so remember, unless it's mixed with something else, and they may tell you, like, I've never felt this way, it's probably mixed with something, think about that. But marijuana in and of itself doesn't have a specific antidote, and it shouldn't consider or make us believe that there's going to be some kind of overdose to it. Now, ecstasy is something a little different. MDMA. These kids, this drug is used by a lot of people that go into the underground type of raves. It causes euphoria, confusion, agitation, tremor, hyperthermia. So this is again another drug. What other drugs cause the hyperthermia? This may be a result of aspirin overdose.